Hi guys, let's go to the sum of questions today. So the nurse is interviewing a client who is being treated for obsessive compulsive disorder OCD. Which of the following is most important question the nurse should ask this client? So you have different types of psychiatric patient in your department. So for this particular case, like obsessive compulsive disorder, which questions you can ask? Okay. So the first question: do you find yourself forgetting simple things? Do you think this could be a symptom of OCD? Next is option is: do you find it hard to stay on a task? Is it a symptom of OCD? Third, do you have trouble controlling upsetting thoughts? Is it a symptom? Fourth is, do you experience feeling of panic in a closed area? So let's go to the rationale, what it says, why three options are wrong and one is correct. Okay, the correct option here is option number 3. Do you have trouble controlling upsetting thoughts? That is the correct option here. One feature of obsessive compulsive disorder is the client's inability to control intrusive thoughts that repeat over and over. Okay, that is a typical symptom of this client. So they don't have any control over their uh, thoughts, like intrusive thoughts that repeat over and over. That is the patient will have. So you ask this question to OCD patients. Okay, the other is, do you find yourself forgetting simple things? Should be assessed to a patient who is having cognitive impairment or some dementia or Alzheimer's, like that. The patients or some cognitive impairment, if you notice, that's the best question to ask that patients. Okay, those type of patient. But then the second option, why it is wrong: do you find it hard to stay on a task? Assesses for disorder that disrupt the ability to concentrate, such as depression. Depression patient has, they have the, they can't focus on something and they can't concentrate. Those type of people, you can ask this, that staying on task is difficult for them. Okay, so then the last one was, do you experience feeling of panic in a closed area? Appropriate to a client with a suspected panic disorder related to closed spaces or claustrophobic patients. Okay, so they are afraid of going to such and they become panic in a closed area or in a claustrophobic situations. Okay, now let's go to the next question. Which of the following action by the nurse would be considered as a negligence? So there are certain situations are given. Negligence means, as a normal nurse should have done it is normally in that situation, that is apt for that future. But something is you're not doing means it's a negligence. Okay, so first option is obtaining a Guthrie blood test on a 4-day-old infant. Second is massaging lotion on abdomen of 3-year-old diagnosed with Williams tumor. Third is instructing a 5-year-old asthmatic to blow on a pinwheel. Fourth one is playing kickball with a 10-year-old with a juvenile arthritis. So we have 4 disease conditions here. So which one a nurse is not supposed to do and she is doing, means then it is considered as a negligence. So let's see. Guthrie test. What is that Guthrie test? The phenylketonuria, PKU. So normally we call that one as a PKU. So that fourth day is doing, that is a normal thing. So everybody does, and there is if doing that, that's not considered as a negligence. Okay, so second one is massaging lotion on the abdomen of a 3-year-old diagnosed with the Williams tumor. That is not, you can't massage over the Williams tumor. What it will cause? It will cause a dissemination of cancer cells. So the nurse is not supposed to do that. So that is a negligence. If she do that, okay, it's a negligence. Then the third one is instructing a 5-year-old asthmatic to blow on a windwheel. That a windwheel is a correct option because exercise that will extend expiratory time and increases expiratory pressure. So that's a good thing. So she can perform, that's normally allowed, and she can perform that. Ask the client to do that. And the fourth option is playing kickball with the 10-year-old with juvenile arthritis. This one also good for this child, because excellent moving and stretching exercise takes place this child. So this can be done. So there is no negligence. That is a good practice. Okay, next question. Let's go to the question number 3 here. The nurse on a postpartum unit is preparing 4 clients for discharge. So it would be most important for the nurse to refer which of the following client for a home care. So something you are expecting that may happen. It's you are not that happy to discharge this patient from hospital. So you need a follow up for this case. So let's see which are the 4 cases here. It's a 15-year-old primary para who delivered a 7-pound male 2 days ago. So that is first case. Second is 18-year-old multipara who delivered a 9-pound female by cesarean section 2 days ago. The third one is a 20-year-old multipara who delivered 1 day ago and is reporting cramping. The fourth option is a 22-year-old who delivered by cesarean section and is reporting burning on urination. So let's go. 15-year-old, 18-year-old, and 20-year-old. Okay, those ones are, they looks okay. 15, 18, 19, they are all teenagers. 18 and 15 teenagers. They may need more support, but they may not may require a follow-up, like due to some medical condition. So which one is required? Because she burning micturition, burning urination, that one required a follow-up. The 22-year-old who delivered by cesarean section and is reporting burning on urination is the correct option. Unstable, she is unstable, indicate urinary tract infection, requires follow-up. Okay, rest everybody is okay. And this cramping after the delivery, that is expected. The other is there is no concern is reported. They are young, they are teenagers, but there is no concern is reported even in the question. Okay, now let's go to question number 4 here. The client who is telling the nurse about a perception of his thoughts patterns. Which of the following statement by the client would validate the diagnosis of schizophrenia? So you are looking for a sign and symptoms of schizophrenia here. So the client says, the first client says that I can't get the same thought out of my head. So is it a symptom you will see in a schizophrenia? Second one, I know I sometimes feel on top of the world, then suddenly down. Then the third option is sometimes I look up and wonder where I am. The fourth option is it's clear that this is an alien laboratory and I am in charge. Okay. So let's see which one will be a schizophrenic patient's the correct symptoms here. So here the first is why this option number 4 is the correct option here. It is clear that this is an alien laboratory and I am in charge. Illogical, disorganized thoughts are typical of schizophrenia. So that option number 4 is a correct. It's nothing is there logical, and it is disorganized thoughts, alien and laboratory. All those things are not there. Nothing existing. This one you will see in schizophrenic patient. Then the option number 1, I can't get the same thought out of my head. Recurrent intrusive thoughts are characteristic of OCD, obsessive compulsive. This is the same thing. Okay, they repeatedly over and over they get the same thinking. They seen in obsessive compulsive disorders. Then I know I sometimes feel top of the world, then suddenly down. So this one you will see rapid changing moods are characteristic of manic phase of bipolar personality. So bipolar disorder you will see the manic phase they are so happy and they are so extreme excited, that's it. But suddenly there is a mode change. Okay, then they feel down. So you will see in manic phase of bipolar disorder. The third one, sometimes I look up and wonder where I am. Confused, disoriented thoughts are characteristic of cognitive disorder. The people are confused. They don't know. Sometimes they see and they wonder where I am. So, those type of thinking happens in cognitive disorder patients. They are disoriented, they are confused, and thoughts are characteristic of cognitive disorders. Okay. So, question number 5. A nursing team consists of RN, LPN, LVN, and NAP. The nurse should assign which of the following to the LPN, LVN. So the licensed practice nurse, which patient you can assign. Okay. So which one? So we have 4 cases here. A 72-year-old client with diabetes who required dressing change for a stasis ulcer. A 42-year-old client with a cancer of bone reporting pain. Third one, a 55-year-old client with a terminal cancer being transferred to hospice home care. Fourth one is a 23-year-old client with a fracture of the right leg who asked to use the urinal. Okay, let's see which one can be an apt patient for care by LPN or LVN, so licensed practitioners. So the correct patient can be assigned to this licensed practice nurse will be 72-year-old client with a diabetes who require a dressing change for a stasis ulcer. So the ulcer is stasis ulcer. So it is she can do, and the patient is the condition is stable and expected outcome. So that. So in this case this case can be cared by an LPN. In the other cases, why not to LPNs is 42-year-old client with cancer of bone reporting pain. This patient reporting pain need assessment. The assessment has to be done by the RN first. Then, if assessment is done, treatment is taken place, then the patient condition is stable. Then you can transfer the delegate other care to by LPN, but first needs to be assessed by the RN. That's why it is not an apt case for LPN. The third option is 55-year-old client with a terminal cancer being transferred to hospice care require a nursing judgment. Okay, hospice care means comfort measures, all those things, but first needs a judgment for this nursing judgment. Then after that, the RN is the appropriate caregiver at this point. Then the last one, why it is wrong is because giving a urinal, so it can be given by a nursing aide. So 23-year-old fracture of the right leg who asked to use the urinal is standard unchanging procedure assigned to an app. Okay. So question number 6. To determine the structural relationship of one hospital department with another, the nurse should consult which of the following. Okay, many of you might have entered the hospital, I will say the board there and it's written like this is the department, this area, and this is this area, diagnostic and outpatient department, all these things like boards you have written. That is the structural organizational chart you will see. So from there you can make which department is connected to which water relationship and determine the structural relationship. So other options given is a job description, personal policies and procedure manual. These are all wrong options. So to determine the structural relationship one hospital department with another is where you will look on a organizational chart. Okay, other job description is, for example, for an RN job description, what is this hospital is asking a nurse to do there, and a personal policies, what are the policies and the other one is procedure. These all institutional things you will see. So when it comes to the job, but the structural the structural relationship of one hospital department you will see in an organizational chart. So question number 7. Now here is a medication pharmacology question. Next one. A client reporting pain in a right lower extremity. The physician orders codeine 60 mg and aspirin grains 10 per oral every 4 hours. So as needed for pain. Each codeine tablet contains 15 mg of codeine Each aspirin tablets contain 325 mg of aspirin. Which of the following should the nurse administer? So 15 mg, so 60 is the order here. So codeine, so you need how many? 15 into 4, 60. So you see 4 codeine here. So first option is 2 codeine tablet and 4 aspirin tablet. Second option is 4 codeine tablets and 3 aspirin tablets. Fourth is 4 codeine tablets and 2 aspirin tablets. Then the fourth one is 2 codeine tablets and 3 aspirin tablets. So one codeine is 15, so means we need for 60 we need 4. Okay, that, so you look for, you eliminate other 2 3 all those things, then we end up having 2 codeine tablets option like 2 and 3. Now you look into the other one, aspirin grains. So 1 grain is equal to 60. Let me see. 60 mg is equal to 1 grain. So here it is, the order is 10 grains. Okay, aspirin and aspirin grains 10 per oral. So you 6, so 10 grain is a 600 mg. So the 4 tablets, 4 tablets and 2 aspirin tablets you have to give. That's the correct option. So 10 grains is equal to 600 mg. So 325 is the order. So 325 divided by 1 is, that's equal to 600 by x, that's equal to 1.8. So and then you are round 1.8 tablets is the order you have to give, and then you are rounding up that to 2. Okay, so it is 4 codeine tablet and 2 aspirin. Okay, so I'll come again with another set of questions soon. Thank you for watching.